Did you know that the way you sleep could be seriously harming your health, without you even realizing it? Sleep is essential for the body to recover, balance hormones, and strengthen the immune system. But if your sleeping position is wrong, especially after 60, it can accelerate spinal wear, affect heart function, impair breathing, and even harm your brain. Science shows that poor sleep posture is linked to problems like sleep apnea, acid reflux, chronic joint pain, cognitive changes, and circulatory disorders, conditions that affect millions of older adults every year. And the worst part? Many of these people have no idea they're sleeping wrong. My name is Dr. William Tharnell, a physician specializing in senior health with over 25 years of experience in geriatrics and integrative medicine. In this video, I'll guide you through a vital warning, the positions you should never sleep in after 60, and which habits can protect your health while you rest. If you care about your quality of life, want to avoid serious illnesses, and wish to age with independence and dignity, then this video is for you. Share this content with your friends and family. Leave a like and subscribe to the channel for more science-based health guidance tailored for those over 60. Let's begin. As the years pass, our bodies change. Bone density decreases, muscles lose strength, joints become more sensitive, and circulation may become less efficient. This means that what was once just morning discomfort can now turn into chronic pain, or even a real health risk. After 60, poor sleep, or sleeping in the wrong position, doesn't just mean waking up with a stiff neck or back. It means compromising cellular regeneration, overworking the heart, limiting brain oxygenation, and worsening existing conditions like arthritis, osteoporosis, or hypertension. Studies published in the Journal of Clinical Sleep Medicine show that older adults who sleep in the wrong positions have a higher incidence of persistent lower back pain, undiagnosed sleep apnea, gastric issues, and excessive daytime fatigue. Additionally, sleep posture can interfere with the brain's lymphatic drainage, a vital process during deep sleep that helps remove toxins linked to diseases like Alzheimer's. So, understanding the right way to sleep after 60 isn't a whim, it's a physiological necessity to keep your body and mind functioning well, with minimal wear and maximum protection. And the truth is, small adjustments make a huge difference. Among all sleeping positions, one poses an especially high risk for those over 60, sleeping on your stomach, also known as the prone position. This is, without a doubt, the worst choice for spine, breathing, and even brain health. Yet, it's still adopted by many older adults who find it comfortable out of habit. When you sleep on your stomach, your neck is forced to one side for hours. This compresses cervical vertebrae, misaligns the spine, and can reduce blood flow to the brain. For seniors, this prolonged twist invites neck pain, arm numbness, and even morning dizziness. Additionally, this position restricts lung expansion during breathing, reducing nighttime oxygenation, especially dangerous for those with respiratory issues like COPD or asthma. And there's more. Sleeping on your stomach puts pressure on the abdomen, worsening conditions like acid reflux and hernias. In severe cases, such as patients with cervical or lumbar osteoarthritis, this position can cause persistent joint inflammation, disrupting sleep and mobility. Tom, a 68-year-old patient, insisted on sleeping on his stomach because he always slept that way. But after developing constant finger numbness and neck pain upon waking, he had to change. Now, with the correct position, he reports more restful sleep and no morning discomfort. Sleeping on your stomach may seem harmless, but after 60, the damage can be profound and long-lasting. When the body lies down, the spine should maintain its natural curve, with the neck, back, and hips aligned. However, many sleep positions disrupt this alignment, creating invisible tension that builds night after night. This misalignment is a leading cause of chronic pain in people over 60. It's silent, progressive, and often ignored, until the discomfort becomes constant. For example, sleeping with an inadequate pillow can tilt the head too far up or down, straining the cervical spine. This affects intervertebral discs, which are already more fragile with age, and can accelerate joint wear. Additionally, if the back isn't properly supported, the lumbar region suffers abnormal pressure. This stress contributes to vertebral degeneration, herniated discs, and nerve inflammation. Studies from the American Academy of Sleep Medicine show that postural misalignment during sleep is one of the most common causes of morning pain in older adults. And the most alarming part? Most don't realize the problem starts at night. Jane, 72, spent years treating lower back pain with medication, with no results. Only after adjusting her sleep posture, using the right pillow and knee support, did the pain begin to fade. Correcting spinal alignment during sleep isn't just about comfort. It's an essential health measure to protect mobility and quality of life in later years. Many don't realize it, but how we sleep directly influences heart function and respiratory capacity, especially after 60, when these systems are already more vulnerable. Sleeping in positions that compress the chest, like on your side without proper support or on your stomach, can limit lung expansion. This reduces oxygen intake, forcing the heart to work harder to compensate. This extra nighttime strain can lead to elevated blood pressure during sleep, extremely dangerous for those with hypertension or heart failure. In seniors, impaired oxygenation can trigger microawakenings, morning fatigue, nighttime palpitations, and even arrhythmias. Research in the European Respiratory Journal links poor sleep positions to a higher risk of nighttime cardiovascular events in older adults with heart conditions. Additionally, pulmonary congestion can worsen in those with mild heart failure due to fluid buildup in the lower airways, something that happens more easily in the wrong sleep position. Mark, 74, noticed he was waking up gasping at night. After medical evaluation, the only change made was elevating his torso with orthopedic pillows and adjusting to a left-side position. Within 2 weeks, his nighttime breathing improved significantly. Caring for how you breathe while sleeping could be one of the most powerful steps to protect your heart and lungs, and it all starts with the right position. Did you know the brain has its own cleaning system, and it only works well while you sleep, in certain positions? This system, called the glymphatic system, removes toxins that accumulate in the brain during the day, including beta amyloid, a protein linked to Alzheimer's. Few realize that this system's efficiency depends on sleep position. Researchers at Stony Brook University found that sleeping on your side, especially the right, enhances glymphatic drainage, while sleeping on your back or stomach hinders it. After 60, when neural regeneration naturally slows, any obstacle to toxin removal becomes dangerous. Chronic buildup can affect memory, focus, and even increase dementia risk. Additionally, sleeping on your back with your head too low can interfere with cerebral venous circulation, raising intracranial pressure and reducing brain oxygenation, a serious issue for those with cognitive decline. Helen, 70, started noticing frequent forgetfulness and poor concentration. After adjusting her sleep posture and using an ergonomic pillow to align her neck, she saw significant mental clarity improvements within 3 months. Your brain needs care even while you sleep, and the simplest way to protect it is by adopting a position that supports its natural cleansing process. Acid reflux is a common problem after 60, and it worsens drastically at night, especially in the wrong sleep position. When lying down, gravity no longer helps keep stomach acid in place. Sleeping on your back or right side makes it easier for acid to flow back into the esophagus, causing heartburn, nighttime coughing, choking sensations, and even throat damage. A study in the American Journal of Gastroenterology found that sleeping on the left side significantly reduces nighttime reflux, while the right side increases it. Additionally, abdominal pressure from soft mattresses or low pillows can worsen acid backup, especially dangerous for seniors with hiatal hernias or sensitive esophagi. George, 67, reported chronic morning heartburn and hoarseness. After elevating his torso slightly and sleeping on his left side, his nighttime symptoms nearly disappeared in 2 weeks. The wrong sleep position can turn the night into a silent trigger for serious digestive damage. If you've ever felt heartburn when lying down or woke up with a bitter taste, pay attention, your body is trying to warn you. Snoring isn't just a nuisance. For many over 60, it can signal a serious problem: sleep apnea. Apnea is when breathing repeatedly stops during sleep, often unnoticed. And one of its main causes in seniors is directly tied to sleep position. Sleeping on your back relaxes throat muscles, allowing the tongue to fall back and partially block the airway. This narrows airflow, causing vibrations, snoring. In severe cases, breathing stops entirely for seconds or minutes, drastically reducing brain and heart oxygenation. Poor posture also affects neck and jaw muscles, worsening airway collapse. According to the Sleep Foundation, untreated sleep apnea increases the risk of high blood pressure, heart attack, stroke, and memory loss, especially in older adults. Sleeping on your side, preferably the left, with proper head support and a slightly elevated chin can significantly reduce mild to moderate apnea episodes. This simple change can improve sleep quality and protect cardiovascular and brain health. Albert, 73, suffered constant fatigue, forgetfulness, and uncontrolled high blood pressure. After being diagnosed with mild apnea, he changed his sleep position and used a pillow to prevent rolling onto his back. Within 3 months, his symptoms improved and his energy returned. Poor sleep can come at a high cost. And sometimes, the first step to breathing better at night is simply changing how you lie down. Have you ever woken up with a numb arm, tingling fingers, or sharp hip pain at night? These could signal nerve compression from poor sleep posture, a common issue after 60. With age, tissues around nerves, like muscles, ligaments, and spinal discs, lose elasticity and hydration. This makes nerves more susceptible to pressure, especially during long hours of nighttime immobility. Sleeping on your shoulder, putting body weight on a joint, or twisting your spine can compress peripheral nerves, causing tingling, burning, or throbbing pain. The most affected areas are the neck, shoulders, arms, hips, and legs. Often, this compression happens silently during sleep, disrupting deep rest and causing daytime fatigue. For example, carpal tunnel syndrome worsens if you sleep with a bent wrist or under your body. Sciatic nerve compression is common in those who sleep with spinal misalignment or without knee support. Dorothy, 76, woke up almost every night with a numb left leg and radiating foot pain. After using a pillow between her knees and an orthopedic mattress topper, the nighttime numbness disappeared in 2 weeks. Ignoring these signs can lead to serious nerve damage. Adjusting your sleep position is a simple yet powerful way to prevent this silent suffering. How your face rests during sleep can say a lot about your health and directly influence your physical and even emotional well-being. Sleeping with your face pressed into the pillow can impair facial circulation, deepen wrinkles, and, more concerning, affect facial nerves. This is especially risky for seniors with a history of microstrokes or vascular fragility. Additionally, when the face is tilted or the chin tucks into the chest, upper airways narrow. This not only increases snoring and apnea risk but also reduces brain oxygenation, critical for memory and mood. Research in Sleep Health Journal shows that seniors who sleep with poor facial positioning report more morning headaches, dry mouth, irritated eyes, and fatigue, symptoms often dismissed as just aging. Another issue is prolonged contact with poorly cleaned or synthetic pillows, which can cause allergies, itching, or worsen skin conditions like rosacea and dermatitis. Nancy, 70, suffered teary eyes and nasal congestion every morning. After switching to an anti-allergenic pillow and adjusting her neck position, these symptoms vanished in less than a week. How your face rests at night reflects how you care for your health. And small adjustments can make a huge difference in how you wake up and live. Deep sleep is when the body truly regenerates. This is when tissue repair, immune strengthening, and essential hormone release, like growth hormone and melatonin, occur. But poor sleep posture can disrupt deep sleep cycles repeatedly, even if you don't notice. The result? You wake up drained, in pain, irritable, and feeling like you didn't sleep at all. Bad posture causes micro-awakenings, brief sleep interruptions that prevent you from reaching restorative stages. This impairs nighttime hormone production, especially melatonin, which regulates circadian rhythm and affects mood, appetite, and immunity. Additionally, when the body can't fully relax due to discomfort, the brain interprets this as a low-level alert state. This subtly activates the sympathetic nervous system, triggering adrenaline and cortisol, the stress hormones. Over time, this nighttime stress response can lead to insomnia, high blood pressure, weight gain, and even blood sugar dysregulation, especially risky for those with prediabetes or type 2 diabetes. Bill, 69, suffered chronic insomnia and morning fatigue. After adjusting his sleep posture with cervical support and elevating his legs slightly, he gradually regained deep sleep and energy. The right posture doesn't just relieve pain, it unlocks sleep's regenerative power, one of the most overlooked secrets of healthy aging. Changing lifelong sleep habits may seem hard, but the good news is, it's never too late to adjust your posture and reap the benefits of truly restorative sleep. The key is gradual, safe adaptation, respecting your body's limits. First, identify your dominant sleep position. Many seniors believe they sleep on their side but wake up on their back or stomach. A sleep diary or asking someone to observe you can help. Next, use strategic supports. A pillow between the knees aligns the hips and eases lumbar strain. A cervical pillow stabilizes the neck. Slightly elevating the bed's head or using shoulder support helps with reflux or breathing issues. Soft physical barriers, like pillows behind your back or beside you, can prevent rolling into unwanted positions. Remember, consistency matters more than perfection. Your body needs time to adapt. Robert, 71, thought changing his sleep position was impossible. With small adjustments, a new pillow, knee support, and mattress elevation, he noticed less lower back pain and more energy within 3 weeks. Changing sleep habits at 60+, 70+, or even 80+ is one of the smartest health decisions you can make. And trust me, your body will thank you night after night. After 60, the best sleep positions promote spinal alignment, good breathing, and proper circulation. Fortunately, these positions are simple and can radically improve sleep quality. The most recommended position for seniors is side sleeping, preferably the left side. This posture aids circulation, reduces heart pressure, minimizes reflux, and enhances brain lymphatic drainage. It also lowers snoring and mild apnea risk while easing back tension. But note, to be truly beneficial, this position requires proper support. A firm yet comfortable pillow that aligns the neck with the spine is crucial. A pillow between the knees keeps hips level and prevents lumbar twisting. For those who can't sleep on their side, the next best option is on your back, with slight torso elevation and knee support. This reduces lumbar pressure and aids breathing. However, back sleeping isn't advised for those with sleep apnea or heavy snoring. Stomach sleeping, as we've seen, should be avoided at all costs. Barbara, 75, suffered hip pain and nighttime reflux. Simply switching to left-side sleeping with knee support improved her sleep and reduced her need for heartburn medication. There's no single, perfect position for everyone, but principles for healthy sleep exist: spinal alignment, even weight distribution, joint support, and open airways. Adopting the right position is a powerful investment in your independence, mood, and longevity. The right sleep position only reaches its full potential with proper support, starting with your pillow and mattress. For pillows, the golden rule is keeping the neck aligned with the spine. Side sleepers need a higher, firmer pillow to fill the head-to-shoulder gap. Back sleepers should choose a medium-height pillow that supports the cervical curve without jutting the head forward. Avoid overly soft or tall pillows. Opt for materials like latex, memory foam, or ergonomic designs. Mattresses should be firm enough to maintain spinal alignment but cushioned to relieve joint pressure, especially on shoulders, hips, and knees. Soft mattresses let the body sink, causing misalignment and pain. Hybrid mattresses, firm support with cushion comfort, are often best for seniors. If possible, choose models with zone support for different body areas. Mary, 78, had constant shoulder pain. After switching to an orthopedic mattress and adjusting her pillow height, she slept deeply again after years of interrupted rest. Now, let's recap the key points. Stomach sleeping is extremely harmful after 60. Left side sleeping is best for seniors. Spinal, neck, and hip alignment prevents pain and disease. Poor posture harms the heart, lungs, brain, and nerves. Small adjustments can transform nighttime health. You now hold valuable knowledge. Sleeping well isn't just about rest. It's about caring for your heart, brain, mobility, and longevity. If this video helped you, leave a like now, share it with friends and family over 60, and subscribe to the channel. Here, you'll find reliable, science-backed guidance tailored for those seeking to age with quality of life. Take care of your sleep. It could be your greatest ally for living better.